Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hi, Dr. Luper. How are you?
Oh, Haley, I'm doing good.
Good. Glad to hear. Something interesting I've seen in the practice quite often is people with these reoccurring sinus infections. It seems that they come in every few months with the same condition, and we do make them, the same nasal spray every single time, but it's happening so frequently. Is there a cause for that?
It's an interesting question you bring up because sinusitis is a common problem.
Wait, sinusitis?
Yeah, that's what their people have is sinusitis.
That's what it's called.
Yeah, so what's happening is they're getting recurrent sinus infections. And let me talk, I'm tempted just to go in and tell you how to solve the problem. But before I do that, so many people
What is it? What's causing
who are
the problem?
watching who have this are going to want to get a little background on like what the normal treatment for this is. So it goes like this. What happens is you get a sinus infection, you go into the doctor says you have a sinus infection, they give you an antibiotic, and if you're lucky the antibiotic works, and then the sinus infection goes away and you're done. Except for it's very likely that you're going to get another sinus infection again relatively soon. And people tend to get, I'd say 1 or 2 or 3 or maybe even more of these a year. They tend to be reoccurring.
Yeah.
At least the folks that we see.
Yeah, at least, the ones that we see, I've seen them come in 4 times, 5 times a year with the same reoccurring issue.
Yeah. So the problem with this is the sinusitis is particularly difficult to treat with antibiotics because the sinus infections they seem to be inside your head, and they are, except for they're outside your body. It's a weird way to think about it, but if you were an ant and you crawled in someone's nose, you could actually crawl back into a sinus, crawl around, and then come back out again and never actually penetrate the body. So it's literally outside
of the body. It's not an internal issue.
Not an internal.
Because the sinuses aren't internal.
So here's the thing about this is if you take an antibiotic, the antibiotic gets into your bloodstream.
Right, and gets into your gut.
Yes.
And affects all your internal systems because it's inside you.
But the only way it can get into the sinuses is it has to be extruded through the mucous membrane itself. And mucous membranes are not really good about getting antibiotics through them. So the antibiotic tends to be low in your sinuses where you need it, and high everywhere else where you don't need it.
Yeah, so they offer these high-end antibiotics to penetrate that mucous membrane while little leaks out, but the rest of it sits and wreaks havoc on the internal digestive system, bloodstream.
Yep.
Wow.
Chances of getting side effects from the antibiotics go up.
Right.
The chances of being effective goes down.
Okay.
So, we got to do it something. You can't suffer within.
Do they have any nasal antibiotics that you can take nasally?
They do, and a lot of times what they'll do is actually give people steroids that decrease the swelling.
So that it can leak through the mucous membrane.
Yeah, and also let the sinuses drain.
Okay.
So that's a cornerstone to treatment of sinus infections, is actually doing some sort of...
And steroids come with their own side effects as well.
So the thing that's getting missed with this is the fact that the mucous membranes are swollen.
And the cause for that swelling is that external? Is that their environment? Is
That's
that...
the real question, isn't
okay.
it? What's causing the swelling?
Yeah.
Yeah, so a lot of times what's really driving this thing is that people have something either inhabiting their sinus cavities, like a low-grade infection or mold or who knows what, some kind of like spores in their house or something. They're getting a reaction from something in their environment or something internally that's causing their mucous membranes to swell up. Once you get that, it's pretty dang near inevitable that you're going to get a sinus infection. The reason for this is as the mucous membranes swell up, they they tend to pinch the openings to the sinuses. Now, sinuses, like, it's a hole, and then air comes in and circulates and air goes back out again. And the reason why we get these sinuses in our head is to make our head lighter. Our head appears to be solid, but it isn't. It's not necessarily mostly air, but it's near mostly air. There's a lot of air pockets in our head to lighten our head up, because we don't need it solid, packed, full of brain and, eyeballs and whatever else. So there's this way to make our head better, and by lining it with air pockets.
Mm-hmm.
Now, the problem with the pinch point is that if that pinch point gets swollen, imagine that's a pinch point right there, and it swells up, now it's pinched.
Mm-hmm.
And now no air can go back and forth through it. And so now that it's pinched, because it's being irritated by something, the oxygen inside that sinus gets absorbed because it's a mucous membrane. It's wet, and the oxygen just basically diffuses into the cells, and it leaves a partial vacuum. The space in the air that used to be oxygen needs to be filled with something. If the oxygen is going to get absorbed, then because the body doesn't like a vacuum, right? Nature abhors a vacuum, so it wants to put something else in there instead. And what that something else is going to be is fluid, nutrient broth.
Sure.
Really,
and then because they're swollen, they can't properly drain.
Yep.
So the fluid kind of lies stagnant, which breeds for bacteria and causes infection.
Yeah, if you didn't have an infection already, you got one coming. And there's no stopping it. Because you have a nutrient broth just sitting there like a little lake.
Oh.
And, this is a part of your body that interacts with the air, and the air's got bacteria in it. So you always have some bacteria in your sinuses. They're not sterile by any means, because they're connected to the world around us. And so whatever organism happens to be hanging out there in the dark, warm, wet, lovely place with plenty to eat says, woo!
Yeah.
Let's build a house.
It's a party place.
And they take up residence, and now you got a sinus infection deep in your head.
So why are sinus infections so hard to treat? And why do they keep coming up reoccurringly for patients who suffer from sinusitis?
So they're hard to treat again because the infection is outside the body. And so if you take an antibiotic, it's hard for it to get there. There's nasal sprays and things you can do, but it's hard to get the nasal sprays back into the sinuses.
Well, why is the antibiotic hard to get there?
Because the antibiotic has to go through the mucous membrane. If you take it, like you go to the doctor, you get a prescription, you open the bottle, you shake a couple pills down, you take it with a glass of water.
Yeah.
It gets into your stomach, it gets absorbed into your tissues, and then it doesn't go to your sinuses.
And it gets absorbed into the bloodstream, so it's going through the digestive system, it's going through the bloodstream, and
There's no bloodstream in your sinuses.
Okay.
The bloodstream goes to the edge of where the mucous membrane is, and that's where it ends.
Okay.
And the infection's over here. Here's the blood, here's the infection, and you got this wall between them of cells that line that entire cavity, and the antibiotics got to leak across. And they do.
Yeah.
They do.
In small amounts.
Yep.
Okay.
There it is.
And so with the nasal antibiotics, the sprays, that isn't as effective either?
No.
Okay.
Because if you do a spray, it sprays into your nose, but your nose is only the hallway. It doesn't get into the rooms.
Oh, okay, because it's so far down the hallway.
Yeah, this is a house. This is the hall. This is the front door and the porch, and then you have all kinds of bedrooms and other rooms, right? And you have to go through those, and they're all swelled up from being infected, and now the spray doesn't actually get up there. So the sprays that actually work are the ones that decrease the swelling.
The steroid
stick with my
sprays.
analogy, the ones that cause the door to open.
Okay.
Now stuff can get back in and stuff can get out, and you can actually drain once you do the steroids. So I'm making a good case for steroids. Steroids are great, except for what really happens is this happens over and over and over and over and over again. I can think of patients that we know that have gone through this over and over and over again.
Yeah,
So
they continuously come in.
So the best way, the thing that really cracks a case like that and gets to the bottom of it is to figure out why their mucous membranes are so swelled up to begin with. What's irritating?
What is irritating? So figure out what in the environment might be irritating them. like allergies or like mold?
Yes. I don't usually start there.
Okay.
Let's just be practical.
So the body system.
Let me say it super easy so you understand it. First thing I look for is, in terms of finding the cause, is food allergies.
Okay.
So food allergies are probably a factor 80% of the time, 85, something like that. So the vast majority of people who have this kind of ongoing problem have some sort of sensitivity to something in their diet, and so they drink a glass of milk and their mucous membranes get irritated and they swell up.
Okay.
Or they eat, I don't know, cookies or crackers or whatever. I mean, it could be anything.
Eggs.
Yeah, anything. So the big ones that people keep getting sensitive to, or more commonly get sensitive to, are the ones that they're more commonly exposed to. So in the American diet, it's wheat, dairy, and eggs. Those are the big three. Those are the ones that people have allergies to. Though it could be peaches, because if you really like peaches and you eat a lot of peaches, and peaches are a more normal part of your life, and you do a lot of peaches, and then now you have a sensitivity to peaches.
Yeah. Yeah. My daughter, for instance, she has an allergy to apples. It's not confirmed by a test, but anytime she eats them, her throat gets swollen and itchy and her lips start to blister.
Yeah,
so
there you go.
I've seen it. Same with carrots for her.
Yeah.
Yeah.
So it's different. We don't understand exactly why people get allergies. It's not perfectly clear. There's a lot of, some people get allergies, some people don't. And some people get allergies to things that they eat a lot of, and some people get allergies to things they hardly ever eat. And so it's hard to say exactly why this is happening.
So,
but nonetheless, if we can find whatever that sensitivity is that people have and avoid it, then we can decrease the chances that people's mucous membranes are swelling up.
So you avoid the food sensitivity that they have. You eliminate that from their diet. Does taking like an antihistamine also alleviate some of the swelling of the mucous membrane?
It sure does.
So like quercetin and nettles is something that we usually use.
Antihistamines, things like Benadryl, stuff like that. But these are
right.
Mainstays in the treatment of sinusitis. The problem is they come with side effects.
Exactly.
They make you dopey and they dry you up, and so you don't. It's certainly, this is a normal way to treat sinus infections. And it's a normal way to set it up where you get one after the other, after the other, after the other. So that's the problem with it. So what we're trying to do is try to break the cycle. Try to figure out what we can do to get it to where people don't have the setup anymore. The setup goes away, and then the infections go away. And honestly, routinely, we can do it. Now, in order to do this, we need to figure out what people are sensitive to. Sometimes it's just a matter of asking, because people already know. It's not that hard to figure out. And other times they have no idea what they're sensitive to. And you have to run a blood test. We run the antibody test. We check people's antibodies. And if they're making antibodies to whatever the food is, that's proof that they got a reaction to that food. And then we have them avoid that or get treated for that. There's some treatments we can do. We can do a whole show on allergies. And I'm on the edge of wanting to jump into this allergy world, but let's back it into the sinuses. And just say there's more that could be said about the allergies. Now, the sinus thing, the linchpin for the sinus infections is the swelling. That's the problem. That's what's driving this thing. It's the bacteria come in and come out all the time. They're just in our environment. So it's not a matter of you got a bad bug. What it is you got a bad bug in the wrong spot, where things are sealed and swollen, and there's nutrients there, and the setup is what causes the infection. So if you can change the setup, then you can change the susceptibility to infection. That's the key. That's what I focus on when people come in with these infections over and over again. And one of the most powerful tools we have to get rid of the swelling is to do nasal lavage. So let me talk about nasal lavage. Nasal lavage is when you snort salt water in such a way that it aerosolizes the salt water, that is, it turns it into a mist. And then the mist follows your normal airflow patterns through your nose, and it gets into all the nooks and crannies, it gets into the crevices, and wherever the salt water touches, it pulls moisture out.
Yeah, does that also cause like an over drying of the sinuses?
No.
Okay.
No, it does not. Good question. It could if the salt was too strong and too concentrated. Now, when I talk to patients about doing this, nearly every one of them cringes because we all know what happens if you get water in your nose. It burns. It hurts. You go to the public pool and you do flips, you get water in your nose and it hurts. You go to the ocean and you swim around and water gets in your nose, it hurts. It hurts all the time. So no one wants to snort salt water because we all know it's going to hurt. Except for the reason why the salt water hurts or the pool water hurts is because the salt concentration is not correct. It's either too low or too high. Either one will burn. So you got to get the salt concentration correct.
And what's the right ratio?
1 cup of water, 1 teaspoon of salt.
Okay.
And so what you do is you get a bowl, regular bowl, that you get your hand into. You pour a cup of warm water, that's 8 ounces of warm water, into the bowl, and you put a teaspoon of regular salt, table salt, in, and you stir it until the salt's dissolved. It'll take a few seconds.
Is there better salt that you can use than just table salt, or
Table
does
salt
it
works
matter?
great.
Okay.
You know, at my house I have pink Himalayan salt. Works great.
Okay. Yeah, that's what I was wondering. I have pink Himalayan salt. I have
Works
sea
fine.
salt. Okay.
Totally effective.
Okay.
And so what you do is you stir it until it's dissolved, and then you take your hand into the bowl of salt water and you cup it, but there's a little bit of salt water on your hand. You go and you snort it right up your nose, and it'll just jump right into your nose and swirl like crazy and get all of the nooks and crannies and open you up like you can't hardly believe. Now they make all kinds of machines to do the same thing, and the machines don't work as well as what I just told you how to do.
Yeah, the machines are expensive. Like
Yes,
the
they
neti
are.
pot. Yeah, neti
It
pots
doesn't
are.
work. It doesn't work half as well.
And I know that during COVID, neti pots were a big sensation with people trying to clean the virus out of their nasal passages.
Yeah, this one's better.
Okay.
Now, having said that, I'd say 50% of the people I tell this to won't do it.
Yeah, it's painful. It's a little painful. It's
not
uncomfortable.
painful. No, it's not.
Okay.
Not one bit. Have you ever done it?
I've never intentionally done it, but I've like jumped in a pool and gotten water up my nose
That's painful.
Yeah.
But not this.
because that ratio
But
is
not
imbalanced.
this. That's the
Okay.
thing. You people know it's going to hurt, but it doesn't actually hurt. So usually what it is people don't want to do it, and then I tell them it's not going to hurt. Give it a go, and they give it a go, and then they come back and say, I cannot believe how much better I feel. Somebody should have told me this years ago. This is a godsend.
So it's surprising that it would be so effective with their mucous membrane so swollen.
Well, what happens is the salt water goes against the mucous membrane because the way when you snort it in, it swirls.
Okay.
The word I used was aerosolize. It turns into these tiny little droplets like mist, and it just simply coats all the little nooks and crannies on the inside of your nose.
And that draws the moisture out of the mucous
Wherever
membrane
the
that's
salt-
swollen?
Exactly. Wherever the salt is, if the salt is more, then the water follows the salt. So what you just did a light coating of salt water on the inside of your nose, and so the moisture in your mucous membranes leaves the mucous membranes, goes into the moisture, and you can tell because you have to blow your nose after you do this thing. And then the little closed ending opens up, and now air can get in, things drain out. You tip your head, and wow, stuff is pouring out of my head. Seriously, you bend your head forward, and suddenly your nose starts to pour because you took that little lake and you tipped it,
Yeah.
and it comes out of your nose.
Well, I could imagine it too dripping through like the back of their throat.
Yes, it can. Better out than in.
Okay.
Yeah, so we're like, we want it out, and we do that. Now your nose.
So
goes
if
up.
people were to do this at home and they felt that nasal drippage in their throat, they would be advised to spit that and not swallow?
Yes.
Okay.
So mostly nasal drip happens on its own because these little sealed things don't seal perfectly, and sometimes stuff drips out, and so you get this post-nasal drip. What I find with doing nasal lavage is you get it all out at once. You don't get a slow drip. What you get is a gush, and everything comes out, and you can breathe. The experience is not, am I a little better? The experience is, I can't believe how much better I am.
So it's
all at
immediate
once.
effect?
Yes.
Okay. And then how long does it last usually? How long do you advise them to
Yeah, good
do
question.
this?
It'll usually last a few hours, maybe half a day, maybe a whole day,
Okay.
depending on how bad you are. If you're really bad, it won't last long at all. If you're not hardly bad at all, it'll last a whole day. So how many times a day can you do this and get benefit from it? I can keep it to twice.
Twice a day, morning
Twice a
and
day.
night?
Yeah.
And so for people who have these reoccurring infections, who have sinusitis, is this something that they have to do lifelong, 2 daily nasal lavages?
No, this is temporary.
Okay.
This is why you have the infection and why you're letting things drain. Mm-hmm. That's what it is.
And while we're figuring out, while their provider is figuring out what is causing the inflammation of their mucous membrane.
Yeah, except for some people, since for whatever reason, no matter what we do, they still tend to swell, their mucous membrane is tend to swell, those people will do it forever. Mm-hmm. And as long as you stay on top of it, you don't get infections anymore.
Okay.
Because the salt water, not only does it reduce the swelling, it also cleans, literally washes out your sinuses and your nasal passages, and the salt water itself is deadly to most bacteria.
So would you recommend even people who don't suffer from sinusitis to do this as like a cleanliness procedure occasionally?
Nope.
Okay.
Nope.
You're making me want to just do it for fun. I feel like there's a lot of stuff in there. Okay.
Well, you could. You know, it'd be interesting to do just to see what it feels like, so that when you did get sick, you'd know, oh, there's a thing I can do. I remember how that felt. So let's talk about what it's like to actually do nasal lavage. So what it's like to do nasal lavage is, it takes a lot of courage, because I'll tell you how to do it, right? And then if you get the bowl and you do the water and you do the salt and you look at it, you go, I don't want to do this.
Do you have to do the whole bowl? Do you have to do the whole 8 ounces?
That's an excellent
okay.
question. No, definitely not.
Okay.
And another thing is, you don't want to take that water and pour it in your nose. No.
Just
not
a
at all.
handful.
Just a handful, and you just sniff it right up your nose. That's all you do. One handful. Except for
one handful.
No. Let's talk reality. When you do have one of these infections, one side of your nose is clogged and the other side is open, and they'll switch. And it's just how it is. Your body's got to breathe, so it opens one side so you can get air in, the other side just closes up. So when you snort it up, almost all the water goes up one side and not the other. So you snort it, and you just know all the water went up my right side. So what you do is you close the right side, and then you sniff it up the left side.
Okay.
So both sides need it. Mm-hmm. One will just take it because it's open, the other one won't. And it could switch later, and usually will. Your body doesn't just keep always the right side open and leave the left side closed. It'll switch. Mm-hmm. A lot of times it depends on what side you sleep on in your bed. If the downhill side tends to clog, the uphill side tends to open.
That makes sense.
As the fluid flows to the other side.
Yeah. It solidifies.
Yeah.
Okay.
And it's not the fluid on the outside, it's the fluid on the inside, actually inside the cells.
Sure.
It tends to have this mass effect as it moves from side to side. So anyways, you snort the salt water, you snort it once on one side, once on the other side, and that's it. Pour the rest out. You don't need that much.
Or save it for later when you do it that night?
No, heaven forbid.
Okay.
Just pitch it.
Okay.
Right? It's salt water.
Is there
what did
any...
it cost? 3 cents?
3 cents, yeah. Is there any other treatments?
Yes. In folks who are just trying to keep their chance of getting a sinus infection down, and they were working on their swelling of the mucous membranes, that you could do this daily. There's patients I have. They're not common. They're uncommon, but they do occur. They just do this daily as a way of keeping good nose hygiene, so they don't get infections. More likely is people are using this for when they have an infection. And so when they have an infection and you want to add a little something extra to get rid of the infection, what we'll do, and you know about this because you make this up, what we'll do is we'll do what's known as a Hydrastis nasal spray. Mm-hmm. And what you do is you do the nasal lavage first, and you clean your nose out, and then clear out the bacteria and open things up, let things drain. And then you take a little spray bottle, and it's got a certain percentage of colloidal silver in it and a certain percentage of Hydrastis tincture. And in fact, I'll just tell you what the percentage is. It's not percentages, but the amounts. It's 23 milliliters of colloidal silver, 7 milliliters Hydrastis. And then you just put it in a little spray bottle, which we have, and you just go, and you sniff, and it goes up there the same way and aerosolizes and goes in little nooks and crannies. It doesn't work near as well to reduce the swelling, but it's not designed to do that. What it's designed to do is to kill. It's an antibacterial, antifungal, and kind of a immune system stimulant. The hydrastis is helpful for that.
The hydrastis specifically is the immune system stimulant?
Yeah, it's an antibacterial in and of itself,
Okay.
for sure, without a doubt. It also stimulates our immune system to work better, so the infection tends to clear up. It's a famous thing to be used to treat infections. The problem with hydrastis, though, is it's an endangered plant, and we just happen to have a lot of it, and so we use it up. And
But it is controlled?
yeah, so there's other herbs that can work just as well as the hydrastis. We just happen to be using hydrastis.
Okay.
But we could use mahonia, for example.
Oh.
That would work about the same.
Okay.
Berberine
Yep.
in general is helpful. And that's what the hydrastis is really doing. It's basically acting like berberine.
And then the colloidal silver is just a stronger antibacterial?
It's not particularly strong. It's an antibacterial for sure. I don't want a real strong one because I don't want to get the side effects associated with the strong antibiotics. But you just go to a regular doctor and get that. What I want to do, and I don't want to kill any gut bacteria, so the colloidal silver will work locally and knock down the bacterial infection locally, but it won't. There's no side effects with it, which is lovely.
Okay.
Now there is, if you were to drink colloidal silver, like by the bottle every day for a year, you would accumulate enough silver in your system that it would change your skin color.
And would that give you, like, heavy metal poisoning?
No, it's
Okay.
not poisoning. There's no poisoning with it. You'll actually be very healthy, and you'll be extremely resistant to infection.
You'll
but
just
you'll
be a
be
little
this kind
blue?
of weird blue gray color. I'm not into that.
No. We want to keep
I
regular
don't want to do that.
complexion.
So I never let patients take enough of it to ever get there. Not even close. Not by a long shot. But just if you thought, oh, this is the greatest thing ever, I want to do this every day for the rest of my life. Yeah, you will eventually turn blue. So it's a bad idea. So it's interesting. I mean, just because you could turn blue doesn't mean you have to take a lot of it.
Yeah.
It is absolutely effective. And I tell everybody, I said, you cannot take this forever because, eventually you'll turn blue. Well, how long do I have to take it for? About a year. Well, how long am I going to take it for this infection? I don't know. A week? 4 days?
So you
it's-
give them like a milliliter nasal spray, or, however,
30 milliliters.
30, yes, sorry. And then that usually lasts them about a week, and then after that,
No,
they don't...
No, they won't use the whole thing.
Okay,
Yeah, it'll last months
okay.
because you hardly use any.
So they just need to use that with the nasal lavage.
Until the infection clears up, and then when you're done with it, just, put it with the pills you have or pitch it because you're not going to use the rest of it.
And then do you continue the nasal lavage after, or does,
It
everything...
depends. Again, most of the time, no.
Okay.
You do the nasal lavage and you're done. You don't need to do anything else. Occasionally, in people who really have a lot of swelling going on, they need to do the nasal lavage every day just to keep the swelling down so they don't get an infection. And they'll do it that way. So I realize we're missing some pieces here. What about the mold thing? You mentioned mold, Dr. Luper. What about mold? And the answer is, yeah, people got mold in their house and they can get a reaction to it. So the best way to figure that out is to actually have your house tested
Yeah.
for mold.
Yeah, and to have your allergies tested, your food
Yep,
sensitivities
that's another thing.
tested, and to test if you're sensitive to pollen or other elements in your environment.
So testing, what you need to do is do some testing to get to the bottom of why your nose is so swollen and why it continues to be swollen more than it should be. Okay?
Yeah,
Yep. There it is.
that's it. We have about a minute left.
Okay.
Is there anything you want to close with?
Yeah, I want to close with, I don't want to eliminate bacteria from people. A lot of times people they're against bacteria because they got infections and we all want to kill it all. Give me a strong antibody. The thing is, it doesn't work. What happens is it weakens us. We do better if we have a normal, healthy bacterial population on our skin, in our mucous membranes. I'm not
In
trying
our
to kill all the
gut.
bacteria, in our gut, right? I'm not trying to kill all the bacteria up there. What I'm trying to do is knock down the population, so not eradicate, mind you, but knock down the population so the infection goes away, so the swelling goes away, so you can breathe again, and not necessarily, create an opportunity where it's a naked desert now, and then bugs come in and they take over.
Right.
We want to leave a healthy dusting of cooperative, helpful bacteria that if the bums from the neighborhood try to move in, they say, hey, we're here, right? And they kick them out.
Yeah.
And so there's this little micro battle that takes place that you never knew about, and yet you come out, better for it, stronger for it. That's how to do it. We want to set it up to where we live on the planet Earth in harmony, as opposed to fighting and trying to eradicate the space around us. It's a mindset.
Right.
So, yeah, that's part of it as well. So.
Wonderful. We are out of time, but thank you so much.
Hey, you're welcome, Ellie.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.